Hello everyone, my name is Odemo Sherifat Oluwadamilola. I came from Nigeria. Back in Nigeria, I was not able to sit properly for long because of scoliosis. That scoliosis is like a growing disorder in your spine, and it was really painful sometimes because I don't see myself like every other person. I can't sit properly. I'm kind of short when I sit, and I can't even sit for long because there's a pain in my spine and even on my buttocks. And I'm not able to wear any clothes like every other person. Every time I will always see myself wearing a larger clothes because I don't want it to be obvious that I have scoliosis. I mean that I'm kind of side bent. But when I came to Fortis Hospital, I met Dr. Miglani.
Sherifat came to me and she had been having weakness in both lower limbs. She had zero power in lower limbs. Obviously the sensation was intact. She had polio when she was very young, so that led to weakness in the lower limbs, and normally people have asymmetric weakness of the legs or hands, but she had complete weakness in both the lower limbs starting from the hips. So she had been trying to use calipers, but she had back pain while she used to sit. Even in chair she needed support. She was not able to sit upright, and she was not able to walk much because of the polio involvement. There was weakness in the trunk muscles, and her spine had become deformed and it was unstable. So the challenge was to, I mean, obviously we cannot give her power in the legs, but the challenge was to make her sit upright comfortably and to make her walk at least with calipers so that she can be more independent. She's a very resilient girl, and she's quite strong mentally and physically as well. She had developed her upper limb muscles and back trunk muscles a lot, and she was able to manage things, but because of the inherent weakness of the trunk muscles, the spine had become weak and unstable. And so we did this, we counseled her about everything and then did the surgery. It was a double curve with long curves and needing a lot of osteotomies of the spine and long fixation starting from upper dorsal spine, and we had to involve the ilium, the pelvis, because the stability was needed. And it was important for her to be sitting upright, and stability of the pelvis was important. It was tilted, so we needed to correct the pelvic tilt, and because the pelvic tilt was leading onto a hip subluxation, so we had to correct the pelvic tilt to stabilize the hips as well. Luckily everything got underway and it went well. We had to be sure that there is no loss of sensation in the lower limbs, and blood and bowel should not get affected, because those things can possibly theoretically occur in the spine surgeries. But we were careful, and we had neuro monitoring just to make sure that she is not worse and she gets only better. And she's been doing a lot of exercises afterwards, and she looks stable, she's happy. That's what I feel.
Thank God I'm able to sit properly now. I can't even sit on this kind of seats before. I would need a guide or holding something to just support myself. But now I can sit for longer than expected, and I can lie down flat. I can do whatever I want now. Viewers in the world, visit Fortis Hospital to get yourself treated. No amount of sickness come first to diagnose yourself.
So as you see, people are really afraid of getting spine surgeries done, especially for deformities, scoliosis, but we have been doing it routinely. We have all the equipment, all the infrastructure to manage it safely. We have an example here who did very well, and there are many more patients who actually do need the surgery, and it can help them a lot, but because of the fear they don't get it done. So don't worry about it. I mean, we are doing these things routinely and have very good results. You can trust us. And on the other side, about the COVID, we have been following all precautions and COVID protocols that are in place, and our place is absolutely safe. We have been doing routine procedures every day, and don't need to worry about COVID, and go ahead with the spine surgeries if you really need it.